Together we achieve victory over heart failure.
Hi, I'm Dr. Naveen, consultant cardiologist, Sevana Hospital, Patambi. Heart, as we all know, is a fist-sized muscle which pumps blood throughout the body continuously. Now, heart failure is a state in which the ventricles are unable to maintain adequate cardiac output to meet the metabolic needs of peripheral tissue at normal filling pressure or requires an elevated filling pressure for doing the same. Now, it could result from structural or functional impairment of the ventricular filling or ejection of blood. More than 20 million people worldwide have heart failure, and the prevalence in India is estimated to be 8 to 10 million, with an annual incidence of 0.8 to 1.5 million, and is a leading cause of hospitalization in the elderly. Now, the three main factors responsible for a normally functioning heart are preload, afterload, and myocardial contractility. Now, in heart failure, there is an increase in the preload, there is an increase in the afterload, and there is a decrease in the myocardial contractility. Now, previously, heart failure used to be classified like acute, chronic, low output, high output, left, right, or biventricular, forward, backward, or systolic, diastolic. But now, according to the latest ESC guidelines, heart failure is divided into three. That is heart failure with reduced ejection fraction, heart failure with mid-range ejection fraction, and heart failure with preserved ejection fraction. That is depending on the ejection fraction. That is EF less than 40 is reduced ejection fraction, 40 to 50 is mid-range ejection fraction, and more than 50 is preserved ejection fraction. Now, coming to the risk factors of heart failure, the main risk factors are coronary artery disease, systemic hypertension, type 2 diabetes, dyslipidemia, and thyroid disease. Now, the heart failure could be aggravated by certain factors like myocardial infarction, any rhythm disorder, intercurrent illness, pregnancy, anemia, systemic hypertension, and pulmonary embolism. Now, how to recognize heart failure? There are certain clinical features like dyspnea, orthopnea, that is dyspnea on lying down, and paroxysmal nocturnal dyspnea, where the patient wakes up about 2 hours after retiring to sleep, gasping for breath with expectoration of pinkish frothy sputum, and there will be an increased frequency of urination at night, confusion, and decreased sleep. Now, there could also be certain non-specific features like nausea, fatigue, anorexia, engorged neck veins, decreased urine output, and fluid collecting in the pleural, pericardial, and abdominal cavity, and enlarged liver. Certain complications of heart failure are renal failure, impaired liver function, electrolyte disturbances, that is alteration in the sodium and potassium level, thromboembolism, atrial and ventricular rhythm disorders. Now, coming to the investigations, firstly, most of the patients go for a chest X-ray or CT, where there will be cardiomegaly and there will be increased brongovascular markings in the chest X-ray, and there could be fluid collected in the pleural cavity. Now, the ECG features include hypertrophy, arrhythmia, active ischemia, and MI. Management includes lifestyle changes and medications. The lifestyle changes include mainly the dietary changes, that is decreasing the salt intake to 1.5 to 2.3 grams per day, and fluid should be restricted to 0.5 liters per day. And also, patients should take care to have a physical and emotional rest. Now, the medicines, the diuretics are the cornerstone in the management of acute heart failure. And for chronic heart failure, there are myriad of drugs, mainly the SGLT2 inhibitors, the ACE inhibitors, the ARBs, the ARNI, the beta blockers, the mineralocorticoid receptor antagonists, the oral guanide cyclostimulants, and the cardiac myosin activators. Now, patients who are refractory to drugs, there are other options like mechanical circulatory devices, which could be implanted either temporarily or permanently. The temporary MCS devices includes the Impella, the ECMO, the Tandem Heart, the Centrimac, and the Berlin Heart Expo, that is mainly meant for the pediatric patients, and permanent MCS devices like the HeartMate 2, 3, and Javi. Now, for certain patients who are refractory to medical therapy, we can also go for heart transplantation. Hope your heart stays healthy. Thank you.